Hey, did you know that physical therapists have this weird superpower where we can assess your gait and walking mechanics almost instantly? Hopefully this doesn't mean you'll dump your friendly therapist, but for real, the reason we're trained to do this is because we're the leaders in gait analysis and treatment. And that's exactly what you're going to learn today in this video. Knowing and implementing proper movements to these 5 body parts can make all of the difference in reducing your pain, enhancing mobility, reducing the risk of deformities, and also looking your best. So if you're ready to walk this journey with me, let's get started. Now we're going to break this down going from top to bottom, and by the way, each section and their specific body parts are made into chapters, which you can find in the description below if you want to skip ahead. But you're always going to benefit by watching the entire video or liking and subscribing to the channel, as this helps immensely. So thank you so much. So starting with the head and chest, the most common problem we find here are heads coming too far forward and maybe looking down with a more pronounced flex forward posture. It's important to change this because these mistakes may lead to more mid-back deformities such as a thoracic kyphosis, neck pain, and even tension headaches. To change this, we want to make sure that we're looking straight ahead with our chest staying high. This means that when we're considering a side view of our body, we want the middle of our ear to be in alignment with the middle of the shoulder. In order to maintain this, we first have to lift our chest high and then retracting our neck backwards. But if you're someone who finds this correction difficult, there is one exercise to complete in order to improve or even enhance this posture while walking. And I have 3 different levels of difficulty. The easiest version is lying on your stomach and having a towel folded underneath your forehead. And the first thing to complete is a chin tuck, and then at the same time you're going to be lifting your arms straight up along with that head and mid-back from the ground. A harder version of this is starting in the same position but now lifting your arms in a W position. Then the hardest version is lying on an unstable surface such as a physio ball, then lifting up in a W position again. All of these movements strengthen your neck and mid-back paraspinal muscles in order to maintain this proper spine alignment during walking. With enough practice and awareness, this first correction will become easier to maintain subconsciously. Alright, moving on to the shoulders, the most common mistake we see here are the shoulders rounding forward too much, and maybe even helping to exacerbate that forward flexed posture. So it's important to correct this because this posture can lead to more stiff shoulder joints, increased muscle tension around the shoulder blades, increased stiffness at the shoulder joint, and this can all lead to more poor lifting mechanics. An easy fix is to first make sure you're completing step 1, and then making sure you're maintaining that middle of ear and shoulder alignment by relaxing your shoulders at your sides while walking. Sometimes, if your shoulders are too tight and still coming forward, they will need stretches to correct your alignment and have a normal arm swing again. And then strengthen the appropriate muscles in order to alleviate a rounding shoulder posture. The first is holding a belt or pole with straight arms, then gently creating this large 360-degree circle one can produce. The other is getting a TheraBand and then lifting up to about 90 degrees of flexion and pulling that band apart at the same time as you're contracting your mid-back muscles. With the right resistance, getting to 20 to 30 repetitions should be a challenge. Now looking at the hips, we should first consider the variation of hip mobility that can vary from person to person. Some people may have hips that are naturally more rotated outward, some rotated more inward, and some that are considered neutral. This natural hip positioning shouldn't be changed, but we will consider it later in other joints. Now there are in fact 2 planes of movement that we have to consider hip movement deviations. This will be in the lateral or sagittal plane, which is a side view, and then the back and front or the frontal plane. So starting in a lateral view, we want to be careful in not overusing our trunk to compensate for swinging our hip forward due to hip flexor weakness, or even using our good leg and trunk to be overused due to increased tone, hip flexor tightness, or pain. We should also take notice in this plane of how equal your step lengths are, which are either limited by hip pain, tightness, or weakness. Now considering the frontal plane, we should first take notice of how level each side of the pelvis is during all walking phases, so that one side of the pelvis doesn't drop too abnormally. And we can also consider how we're swinging our hips forward by avoiding a circumduction compensatory movement. And of course, minimizing overuse of our trunk moving from side to side in this plane is also important. Having strong and mobile hips is crucial as it plays a major role in protecting your back and starting the correct chain of movement in your lower legs. So now let's take a look at how we can correct these hip movement mistakes in both planes of movement. In a side view, we first want to hold our trunk upright as best we can during both the swinging phase of the hip and standing phase. Normal hip range of motion during swinging should reach about 30 degrees flexion. Then when we begin to stand and shift our weight to this leg, we should reach a maximum of 10 degrees extension until our heel lifts off the floor. In a frontal view of the hip, we should have a level pelvis during both swinging and standing phases of walking. However, sometimes when we're standing on the bad leg and our opposite hip drops greater than 5 degrees, then this could be a cause from either hip abductor weakness or hip joint issues. Now, if any of these hip errors resonate with you, then I have 2 exercises to perform at 3 different levels of difficulty. First exercise will be to help in our first plane of movement for flexion and extension. You'll be standing and holding onto something for hand support to maintain balance, and then slowly you'll flex your hip with a straight leg, and then slowly extend back as far as possible. A level up would be to complete this with no hand support or less hand support from the first. Then the last level is then adding weight to the ankle in order to enhance strength. The next exercise will help hip errors in the frontal plane of movement that will target your lateral hip abductor muscles. As before, you'll hold onto something sturdy for hand support, then slowly kick to the side to no more than 45 degrees. The next level will have no hands or less hand support, and the last level will have additional weight to the ankles. Now, looking at the knees, we will again look at a side view of the knee and then a frontal view. Beginning at the side, there are 2 problems that typically occur here. First, the knee must straighten at certain points in the walking cycle, but sometimes we're missing a few degrees of movement that can bring on a significant impact to how we walk. And then counter to this, sometimes we overuse knee extension that could hurt the integrity of the knee joint and have inadequate use of muscles in the thigh. The opposite movement in the knee we have is bending or flexion, where again a certain degree of movement could be missing or overused at certain points in the walking cycle. Now, considering the frontal plane, there are 2 common knee deformities called either genu valgum or knock-kneed, or genu varying, being bow-legged. Both of these could be a consequence of knee joint osteoarthritis or weakness at both the knee and the hip abductors and or external rotator muscles at the hip. So what the heck do we do from here? It's first important to understand what normal knee joint range of motion should be and which muscle groups are responsible for that in order to make meaningful changes. Again, starting with our side view, the knee will first have 5 degrees of flexion at heel contact, flex a bit more to 10 degrees with the flat foot, then begin to straighten until the heel lifts off. At this point, the knee begins to rapidly flex up to 60 degrees until stepping forward, where it then undergoes rapid full extension until making heel contact again and starting the walking cycle over. In the frontal view, we consider minimal to no knee movements in this plane. This means that the middle of your kneecap should be in a certain alignment with your hip bone and the center of your ankle. This is what we call the Q angle. For females, the Q angle should be about 15 to 20 degrees, and males should be about 10 to 15 degrees. Any angle beyond this range is considered abnormal. So finally, with all of this information at the knee, there are 3 exercises that will be foundational in returning normal knee range and strength. The first will be knee extension using a machine from the gym in order to enhance your quadricep strength for knee straightening. Then opposite to this will be the leg curl machine, which will enhance your hamstring muscle strength for knee bending. However, since walking is of course a weight-bearing activity, we should also add in squats at 3 different levels of difficulty. The first will be squatting with hand support, then squatting with no hand support, and then adding weight by either holding it or using the leg press machine. And that's it for the knee. Now for the final joint we're going to consider in the gait cycle, the ankle and the foot to also play a critical role in both our lateral and frontal planes of movement. Now, there are many types of walking compensations that can happen due to ankle injuries or conditions, so we're going to break these different issues down by the affected muscle groups. The first is weak or affected dorsiflexor muscle activity, and this can cause a foot slap or in more severe cases, creating a foot drop on one or both sides, which can give the following compensations. Now, if there is limited ankle dorsiflexion mobility or stiffness, we may see a type of circumduction compensation during the leg swinging phase. If we have tight or contracted plantar flexors or calf muscles, this can affect one side that might be due to a contracture, or both sides creating a toe walk due to idiopathic conditions such as cerebral palsy. And this is just one example. Now, having weak plantar flexors can give 2 types of compensations where one can't push off from the ground adequately and uses more of a heel walk or either hyperextending the knee back. Next, a weak posterior tibialis muscle can give a pronated gait or flat foot during the standing phase. This is when the medial arch of the foot collapses due to the weak posterior tibialis, unable to help stabilize that mid-foot arch. Opposite to a flat foot, there can be more of a supinated foot caused from neurological conditions such as Charcot-Marie tooth disease, where one is walking more on the outside edge of the foot. Again, this is just one example. Other compensations that can be seen due to increased ankle-foot instability or pain could be a limp where there is a shortened time standing on the affected limb, a lateral trunk lean to offset weight to the painful limb, or even a shortened step pattern. Lastly, we can see the ankle perform a medial or lateral whip during the swinging phase of walking, which can be caused from weak ankle stability muscles or poor walking mechanics. Okay, now let's look at the correct walking mechanics for the ankle in both the lateral and frontal planes. So starting in the lateral plane at heel contact, the ankle will be in neutral or at a right angle. From here, you'll have controlled plantar flexion where the foot is making full contact with the ground. Then the ankle will switch to reaching a maximum of 10 degrees of dorsiflexion and the rest of the standing phase, until the ankle begins to rapidly plantar flex again to about 20 degrees in order to push off from the ground. During the movement phase, the ankle begins to dorsiflex back to neutral before making contact with the heel to begin the full cycle over again. In the frontal plane, the foot is more supinated at heel strike, and then the foot begins to pronate throughout most of the standing phase until the heel comes off the ground again. During the full swing phase, the foot is set in a neutral position. Now, if you couldn't tell, that was a lot of information for just the ankle and the foot, but I was still able to simplify everything down to a few foundational exercises. So we're first going to consider normal ankle joint range of motion, where you should first try to reach your end range dorsiflexion by sitting in a deep squat while using hand support such as a door frame as needed. To reach end range plantar flexion, you'll try to hold a kneeling position while also using hand support as needed. If you can complete both of these movements, your ankle range is in great shape. Now we want to begin strengthening all ankle muscle groups. So the first will be using a TheraBand resisting all four planes of movement as shown, and a level up from here is going to be taking a loop TheraBand around your midfoot and then performing heel raises and then toe raises while trying to pull apart that TheraBand at the same time. Similarly to this, you can also take a small ball and squeeze this while performing heel raises and then toe raises in order to activate different ankle stabilizer muscles. And that's it for the ankle and the foot. And if you want to stick around a little bit more, I have bonus tips coming up. Before we close, I want to give other tips on more quality of movement for walking. The first is to be aware of how far apart you're stepping from one foot compared to the other. We call this your step length, and it's important to know that you're loading one leg the same amount of time as the other. After thousands of steps or repetitions per day, this can have a dramatic impact on one's leg strength endurance. Similarly to this, being aware of the width distance from one foot to the other. We call this your step width, and this can give information about your balance during walking and lateral stability strength, primarily at the hips and the ankles. Next, I want you to ask yourself what your speed is like during walking. It is generally true that walking faster can give you cardiovascular benefits and maintaining good balance. However, increasing your walking speed shouldn't be at the expense of reducing your quality of movement or even your safety. Lastly, let's talk about balance when walking. Your quality of balance depends on multiple factors. First is having good vision to recognize obstacles. Your vestibular system allows your head to detect motion in space. Proprioception is where your body can be aware of how you're moving in space through muscle, tendon, and joint feedback. The level of sensation you have at the bottom of your feet. Coordination between your arms, legs, and trunk, muscle strength from the core and every joint in the legs, your reaction time to navigate obstacles, good joint mobility and flexibility to a certain extent, and of course your cognitive function. Now this list was not meant to scare anyone, but to give more information on which factor or factors could be limiting your quality of balance when walking. And my tip here is to first recognize where you're at and then start working on it today. So before we part, I want to leave you with a couple of resources if you think you found this video helpful. First, I created a list of all of the exercises in this video with a little bit more direction along with a picture and video format to perform at home. You can find this linked here or in the description below. Second, if you think you would benefit from more analysis on your walking, I am able to analyze your walking through video format. And then there's the option to discuss it one-on-one together. For my analysis, I would give more specific exercises more suitable for you. You can follow the directions here or in the description below to get started. As always, thank you so much for watching, and I hope that your walking is on its way to finding beautiful places on this earth and with loved ones. Don't forget to like this video and subscribe to the channel, and always remember, it's a work in progress. See you next time.